All right, so we're going to move on to chapter 12, shock. You need to keep in mind that in order to understand how to assess and treat shock, you have to understand the pathophysiology. So as a reminder, perfusion is the circulation of blood, which thus includes oxygen to the cells. Perfusion means that the cells that need oxygen are getting it, and the waste that is produced is being removed from the body. When you have poor perfusion, we're going to call that shock. And when this is happening, what normally is the cause is not lack of oxygen, but the lack of removal of the waste. So the carbon dioxide isn't getting removed out of the tissues, so it is not getting removed out of the body, and therefore you have this buildup of the waste causing cellular damage because there's no free space for oxygen to flow. Shock is the result of the failure of the cardiovascular system. It is the failure of the blood, of the components of the blood, of the vessels to do what needs to get done. When we do not catch someone who is in shock, and when we do not treat someone who is in shock, you're going to see death happen pretty quickly. So, understanding that the cardiovascular system has three parts, and I like to think of it as a well system. So the pump, the pipes, and the fluid. So the pump being the heart, and the pipes being the blood vessels and the arteries, and then the fluid is the blood and all of the components of the blood. It's a very complicated picture of the heart to remind you that it goes in and out and round and round. So it's got to go into the heart, but not just that, it's got to go to the lungs for the deoxygenation, or for the oxygenation of the blood. And then it's got to come back to the heart to go into the body. This entire system, lungs, heart, vessels, are all necessary for good perfusion. Understanding that there's what we like to call the perfusion triangle. We like our shapes. And you've got the heart, the blood vessels, and the blood. At any point, if one or more of these pieces collapses, you no longer have the triangle. Your heart failures, your blood vessel fails, your blood fails, then you're going to go into shock. You must have all three components to have good perfusion. The minute one of them begins to fail, it is going to lead to your patient to have poor perfusion and increased chance of shock. So, blood pressure is, of course, the pressure of the blood within the vessel. As we talked about in a couple lectures ago, the blood pressure is a fraction, with the systolic being the pressure at contraction of the ventricle, and the diastolic, your bottom number, being the pressure when the arteries are at rest, when your heart is not beating, when it is relaxed. So your systolic should always be higher than your diastolic. Your vessels should be under greater pressure at contraction than they are at relaxation. Now, we also need to understand that the pulse pressure exists, and we don't measure this specifically, but it is that difference between the systolic and the diastolic. And a pulse pressure less than 25 millimeters of mercury may be seen in patients with shock. So when my blood pressure, which is normally 120/70, let's just pretend, is now 90/65 or 90/70, we've got a massive problem. It's why vital signs are going to be important, but of course aren't going to be the end-all be-all diagnosis of shock. We don't want to see your systolic and your diastolic getting closer. That is a sign of significant medical issue. We know that the blood flows into the capillary beds because at the cellular level, that's where gas exchange occurs. Understanding that it's regulated by the capillary sphincters, and that these contract and expand and are actually responsive to other stimuli besides the autonomic nervous system. So when it's too hot, when it's too cold, if they need more or less oxygen or more waste removal, your capillary sphincters will respond appropriately, or they should. So again, perfusion, while it is the blood circulating to the cells, in order to be appropriately perfused, you've got to have oxygen in the bloodstream. So we do require that the lungs are functional to say that a person has adequate perfusion. We do have mechanisms in place, hormones, we have the autonomic nervous system, we have other ways that our body reacts to ensure that the vital organs are getting perfused. We have the ability to compensate for periods of time if there is the beginning stages of failure in any of our body functions that support perfusion to our cells. We know that hormones sense pressure falling, they sense chemoreceptors sense the waste in the bloodstream, and all of these will trigger a reactive response to ensure that the body is getting what it needs. So, for instance, hormones may recognize that there's low oxygen. And in order for the body to compensate, it may say, you know what, one of the best ways to get more oxygen to the cells is to move the blood quicker. So let me increase the heart rate. Or it may say, you know what, I know how we get more oxygen. Let's breathe quicker. So the hormones will cause an increase in respiratory rate. Or, hey, you know, another way to get blood quickly with oxygen quickly to the cells is let's constrict the blood vessels. It'll move faster. It'll be under greater pressure. And all of those are the result of hormones that are telling our body that something's wrong. So what this means is we are looking to create a system that ensures the sustainability of our organs. We want to maintain a specific pressure to make sure that the blood is flowing how and where it needs to, and moving the oxygen and removing the waste. So, now that you understand how the body responds and the need for perfusion, let's look at what can cause shock. So, if we've said that the cardiovascular and the respiratory system are all important in ensuring appropriate perfusion, then obviously when those fail, we are going to begin to see a patient's increased risk of shock. So, when I have damage to my blood vessels and I'm losing blood, then I'm not going to have the fluid and the components of the blood that I need in order to move oxygen and remove waste. And this is actually a really great image to identify that. So picture A is pump failure. When my pump doesn't work, it doesn't matter whether I have all of the fluid in the pipes that I need or whether my pipes are in pristine condition. It's not going anywhere. So I need to have my pump working in perfect condition as well. Picture B, the low fluid volume. So trauma to the blood vessels that cause you to have an internal or external bleed. Or, and people seem to forget about this, dehydration. So our blood is comprised of red blood cells, white blood cells, and plasma, and the plasma relies on a person being appropriately hydrated. So if you have a person who is dehydrated, they're going to have a blood volume issue and may show signs of shock. And then C, poor vessel function. So we require our vessels to expand and contract based on need. And when my vessels do not function appropriately, then I am going to not see my body react to the pressure change needs. And that's going to cause problems. You can see on the slide here some examples. So pump failure, an example is a heart attack. Low fluid, vomiting and diarrhea can cause this. And then vessel function, a spinal cord injury where my nerves aren't getting the messages that they need to constrict the blood vessels. And table 12.1. I'll repeat, table 12.1 in your book gives you another list of some great examples of failures and causes of shock. So specifically, we're going to break it down into a couple of different types. And the first type is cardiogenic shock. So cardiogenic shock refers to shock that is the result of failure of the pump. It is inadequate functionality of the heart to support the body's needs. Can be the result of many things, but really what it causes is a major backup of blood into the lungs. Remember, the blood pumps from the heart and into the lungs, and then from the lungs and back to the heart. So if the heart isn't pumping under enough pressure, then you're going to see the blood in the lungs sit there. And then more blood's going to come, and it's not going to move. So we'll start to see a buildup of fluid in the lungs, which is obviously a bad thing. So when you've got that edema or that fluid, it's going to hit the cells. And instead of perfusing oxygen, you're going to have fluid that's going to sit in the cells. So you can't put oxygen where there's fluid, and you're going to see that impact a patient's oxygenation of the tissues. Pulmonary edema is going to lead to wet lung sounds. So it's going to sound like your patient has fluid on their lungs, because they do. It's going to lead to an increase in respirations, because the hormones in the body are going to tell it, hey, you don't have enough oxygen. Let's breathe more. You're not breathing enough oxygen into the bloodstream, so we're going to increase respirations. Again, this occurs when output doesn't equal demand, and that is going to be cardiogenic shock. Being cardiac tamponade. So cardiac tamponade occurs when you've got fluid buildup in the heart sac or the pericardial sac. And that is not going to allow the ventricles to expand and contract appropriately. So it's not going to fill and push at the blood that it needs. So one of the signs and symptoms we talk about with this is the Beck triad. So there's 3 signs and symptoms that are very indicative, kind of point to the consideration of cardiac tamponade. The first is jugular vein distension. So you know the jugular veins are in the neck. When you're doing your head. Next is a tension pneumothorax. So tension pneumothorax is caused by damage to the lung tissue. And when this happens, the lung tissue normally causes there to be a hole or some sort of opening that allows the oxygen and air to escape the lungs into the chest cavity. A tension pneumothorax is closed, and so you end up having the air held within the chest cavity that then puts pressure on the heart and the other organs, not allowing them to relax and expand appropriately. And then finally, you have the pulmonary embolism. A pulmonary embolism is caused by a blood clot into the lungs that blocks the flow of oxygen from the heart to the lungs and from the lungs to the heart. This is going to cause catastrophic failure. And not only is it going to cause obstructive shock, it's going to cause failure of the heart as well. So you're going to have all cardiogenic shock that results the more it is left untreated. So distributive shock, our next kind of shock, occurs when there is dilation at the small vessels, so the arterioles and the venules, or even both. And what happens when these areas dilate is that the blood doesn't move into the capillary bed to allow gas exchange occur. It just sits and pools in those dilated vessels, and as a result you have decrease in your tissue perfusion. Then you've got septic shock. So septic shock is infection. And what happens is an increase in the bacteria and toxins in the vessels in the tissues. And you end up having wall damage. That means that you have leakage. So when a patient's in septic shock, the component of the blood, the fluid, the plasma, they actually leak through the vessel wall into the tissues. And as a result of the breakdown of the vessel wall, the blood vessels are no longer able to contract the way that they need to affect the pressures. Septic shock leads to widespread dilation of the vessels. So not only do you have a decrease in the composition in the fluid, but you also have a failure of the pipes themselves. So septic shock causes two parts of the cardiovascular system to fail. Now we move on to neurogenic shock. Neurogenic shock is normally a high spinal cord injury. So it occurs when there is a disruption in the spinal cord that prevents the neurons and the nerve messages from being sent and received to the vessels. Some of the reasons you see are brain conditions that cause it, tumors, pressure in the spinal cord, or spina bifida, so when the spine at the base of the spine doesn't actually form correctly. Neurogenic shock doesn't allow the messages for dilation or for constriction to be sent to the vessels. And so when pressure changes should happen, they're not happening. So you end up having a person who isn't having the vessels contract when they need additional pressure. Remember, any part of your body that doesn't receive a job, so that's not being told to do work, is going to relax. So relaxation of the blood vessels means that you're going to see a bottoming out of the blood pressure, a significant drop in the blood pressure. So how do we get those? How are we exposed to the allergen? Well, you eat it, you are injected by it, so a shot of penicillin or an antitoxin, you have stings from bees and stinging insects, and inhalation, so you breathe in dust or pollen or some other type of airborne allergen. And again, I'm not talking about the sniffles that you get when you have seasonal allergies. Anaphylactic shock is severe, sudden, and life-threatening. Signs are very distinct, and because of the airway closure, you will see cyanosis, but this is a late sign. Don't sit around waiting to give the medication to treat this, just to wait for cyanosis. We will learn much more about the actual administration of the medication in the allergy and allergic reaction chapter, though. Picture for you of table 12.2 of all the signs and symptoms of anaphylactic shock. It's the itching and the hives and swelling of the tongue. And if you've ever seen Hitch, and I'll try to add that to the allergic reaction chapter if we're still not in person, it's kind of all of that. Or none of it. It really depends. But life-threatening, of course, we're looking for that closure of the airway. And then you've got psychogenic shock. And all of those Vine and TikTok and YouTube videos out there, and someone who gets scared so much that they faint, or they're surprised so much that they pass out, that's actually psychogenic shock. So psychogenic shock is caused by a sudden reaction of the nervous system to drop the blood pressure, so to dilate the blood vessels quickly to the point that the body can't shift oxygen and blood to other areas in a quick enough time of reaction. And psychogenic shock just results, hopefully, in just fainting. But because of the fall, There is always the possibility it will cause traumatic injury, but the other concern is that psychogenic shock is actually the sign of something more significant and serious. We do, and those are the significant and serious causes. So if you've got a heart murmur or a brain aneurysm, obviously that is much more significant than just saying, oh, she just passed out. So we always talk about people who have fainted, trying to make sure that they at least follow up with a doctor, because there could be an underlying condition we're not aware of.